Hi everyone, myself Saranya, Assistant Professor, SNS College of Allied Health Sciences, Coimbatore. Today we are going to discuss a topic on tracheostomy care. A tracheostomy is an artificial opening in the neck in the windpipe. It is an opening for providing an ventilation. This opening is called a stoma. It allows the air to go in and out of the lungs. It allows any mucus to be removed. It is important to proper tracheostomy care to avoid the infection. So, as a healthcare provider and as a person who is taking care of the patients in home, also do the tracheostomy care in a proper way. How to do a tracheostomy care is depends upon the parts of the tracheostomy tube. So, tracheostomy tube care can be done in hospitals or else in home settings. Tracheostomy care involves sterile techniques and the clean technique. So in sterile technique, the equipments are packed and are free of germs. Use sterile gloves for a proper hand washing technique. In cleaning technique, cleaning is based on the parts of a tracheostomy tube and its situation. So the tracheostomy tube has different parts. Which one is called as cuff, inflation line, cuff port, lower lock, 15 mm connector, neck flange, outer cannula, inner cannula and obturator. Each has its difference of functions. So the cuff is a balloon at the end of the tracheostomy tube. Where it gets inflated, it forms a seal against the wall of the windpipe. So the inflation line is a thin plastic tubing that carries air into the cuff. The cuff port is the port where it is inflated, it shows the balloon inflation. It is also called as pilot port. The lower valve, which is a syringe that is connected to inflate or deflate the cuff. The 15 mm connector will be used for connecting that with the ventilator. It has a neck flange to tie the tracheostomy in a proper way for secure purpose. And the outer cannula is inserted into the tracheostomy. And obturator, it is used it acts as a guide to insert the tracheostomy tube. Humidification is a major factor. Why? Because bypassing the nose and the mouth by breathing through the tracheostomy makes the mucus to be stuck in the cough. So it can lead to a lack of moisturizer. So the method is to increase the moisturizer by drinking a plenty of water and using an humidifiers. Tracheostomy skin care. The stoma care is very important. Why? Because it can cause an infection. So here it is the protocols or the equipments which has been needed to do a proper care. So you have a gloves, clean cotton, lint-free and white washcloth towel, mild soap and water, hydrogen peroxide and you guys a gauze for placement of the stoma and the cotton tip applicator while using a cleaning of the stoma and container to mix the hydrogen peroxide and saline and clean tracheostomy ties can be used. How to do a proper dressing for the tracheostomy stoma to be cared. So open the sterile gauze and fold that according to the 4:4 gauze into a fullest length and fold the gauze in half lengthwise to form a long and thin rectangle and fold at the center of the gauze. You make a V shaped and put the gauze at the neck flange as like we have provided in the image here. Suctioning is an important factor that a healthcare provider needs to do to remove the suctions inside the lungs. The equipments needed are the suction machine, suction catheters and a bowl. So clean and disposable powderless gloves could be used before handling a patient. Proper towel and facial tissues or napkins to be used and a bowl or a glass or a plastic cup is used to remove the suctions and fill it with the fresh water and cool water and finally after the suction is given, give proper oxygenation and resuscitation therapy if needed. Caring of the inner cannula. Inner cannula will be inserted into the tracheal tube. So the inner cannula carrying is very much important. So soak and rinse the inner cannula in a hydrogen peroxide and cool it with the cool water. A small bowl is filled with a mix of equal parts of hydrogen peroxide and the water. Tracheostomy brush or a pipe cleaners can be used. Clean with the proper gloves handling technique. Tracheostomy cuff care. The tracheostomy cuff is placed an inflatable cuff that is attached to it. So first before removing it, deflate the cuff once again and you can wash it as per the technique what we have shown in the inner cannula. So the reasons for using a cuffed tube is to prevent the choking, prevent a seal and using a breathing machine or a ventilator to be connected to the patient. Thank you for listening to the topic.